Chitrali, great to see you. Thank you for joining us today. For everybody tuning in, so Chitrali Sood, Dr. Sood is the advisory board member at Let's Get Checked. She's a farm doc, but I'll let you explain, Chitrali, what that actually means to people. Maybe a little bit about your background, your education, and what you do in your day job, and then we can go in from there.
Sure. Thanks for having me. A farm doc is basically a doctor of pharmacy. You go through the same schooling. And I work right now at Virginia Hospital Center, the outpatient pharmacy, where we do patient discharge medications and just fill prescriptions for patients that are in the hospital. We do blood pressuring monitoring, immunizations, and also, we're starting to do some flu clinics as the season approaches.
And with flu clinics, you guys will be actually administering the flu vaccines and things along those lines?
Yep, flu vaccines. We also do a whole array of different vaccinations as well.
Hopefully someday vaccination for COVID-19, huh?
Yes, hopefully.
Yeah, yeah. Well, speaking of COVID-19, I know obviously it's turned everybody's world upside down. It's literally turned our world upside down, and I suspect down in the pharmacy it's been no different. What happened when the pandemic first showed up? Did you guys have to close down? What was sort of the early days like?
Right. So being essential, healthcare frontline workers, we did not close down. Our doors remained open. We had a lot of COVID patients that we were actually delivering meds to before they left the hospital. So there was no closing down. It remained open for patients to still come in, although we did start offering curbside delivery, which has been a huge hit. So there's less foot traffic in the hospital, and doing some 90-day fills for patients so they don't have to keep coming in.
And I'm just going to sort of, in no specific order, kind of throw some of these out at you and
Okay.
get your response back. But I know personally that in the periods of time when I've had to be on an antibiotic for whatever infection, and obviously this is nothing related to COVID, um, always get a strong recommendation to complete my entire course of antibiotics. And I'm wondering, where does that come from? What do you have any sense of the rationale behind that? In other words, if my physician prescribes antibiotic for something for 5 days and 2 or 3 days into the antibiotic course, I'm feeling a lot better. Why is it important that I still continue and complete that course of antibiotic?
Right. That's a great question. So even if you start to feel better after taking your antibiotics and your symptoms go away, the bacteria may still be present in your body. So you want to make sure that you take the full course because you want to prevent that bacteria from growing and spreading. So taking that, to the full course allows that time period for the antibiotic to actually kill off the bacteria. So that's the main reason. I know right now doctors are trying to do limited, days for antibiotics because they don't want your body to get used to it. So the shortest, I know the doctors do the shortest amount of days, and so that helps prevent any reinfections.
Got it. Makes sense, but I appreciate the explanation. Um, Another question, again, sort of just kind of spitballing here, throwing these things at you from left field, is around the idea of generic drugs or generic medications. I've certainly gone myself to pick up a prescription, and been asked, well, your doctor prescribed medication A, but if you in fact will have medication B, which is very similar, but it's a generic, it'll cost you so much less money or something. Are you okay with that? Or I've even had the instance where sometimes the medication's been prescribed and I go to pick it up and what they hand me, to my mind, seems different, but in fact is an equivalent medication. So what does generic really mean? What should consumers be thinking about in terms of, should they be looking for generic? Should they be rejecting generics? How do we navigate that?
Right. So basically, generic medication is almost the same as brand. It has the same ingredients, the same benefits, the same safety profile, effectiveness, strength, and quality. Generic drugs have to go through a rigorous process with the FDA to get approved. So it is the same exact thing. The only thing is that they may look different because different, generic manufacturers are producing them. And the reason why they're less expensive is because they don't have to go through the same clinical and animal studies, because the brand has already done that for you. So that's why it costs less money to make, and it's obviously to the consumer less expensive.
So then if I'm sort of understanding this correctly, if somebody were to say, if the pharmacist were to say, $10 a pill for branded medicine, I don't know, some less amount. I don't know what the typical reduction in price is between a branded and a generic, but I think it's probably pretty significant. That if I were to say, okay, give me the less expensive branded version, then I'm not really shortchanging myself in terms of treatment efficacy or anything like that. Is that correct?
That is correct. Yes, efficacy, safety profile is all the same, and typically generics are 85% less than brand names.
Wow.
Yes.
And is that the idea around offering a generic versus a branded? Is that something that's left to your discretion as the pharmacist who's going to be fulfilling and dispensing those prescriptions, or how does that world work?
Right. So what pharmacists usually do is they always dispense the generic unless it's specified by the physician, or the patient can say, hey, look, I want the brand name. And then sometimes when they see the price, they go back and say, generic's fine.
Right.
Yeah.
And how long is it usually between when a medication first gets sort of released to the marketplace? A new medication gets developed by a company. It goes through all the rigorous FDA approval processes, and then becomes commercially available, and where you'd be able to have it available at your pharmacy. How long between then and when a generic in that medication would be available? In other words, I assume it's not the same day. In fact, I know it's not the same day.
So basically you have to wait till the patent expires of the brand name drug, which is about 7 or more years. And then another company can come in and, kind of take over and start making the generic.
Recently in my house, there was a medication that was discovered in one of our medicine cabinets. And we noted on the bottle that the expiration date had been quite a while back. Let's say 3 or 4 years back was the expiration. We just hadn't needed the medicine in that time frame. And so then this ensued a lively debate in our house about whether or not it was safe to use that medication, or whether it needed to be disposed of and we needed to try to get a new prescription for that medication. So can you tell us all a little bit about, how those expiration dates get determined? How important are they, and how one should react to a bottle in the medicine cabinet that expired the last decade or so?
Right. So how we determine expiration dates, they're usually on your bottle, and they're usually expire 1 year from when they are dispensed. So 3 to 4 years, obviously long time, it's lost its efficacy. So you want to basically, the first thing people think of when they dispose of medications is, oh, let me just flush it down the toilet. And that not all medications can be flushed down the toilet. There is a specific list that could be found on the FDA website. My first recommendation is drug take-back programs. There's a lot. They happen twice a year, and they're in every county, every community. Also, a lot of pharmacies have these bins that you can take your medicines to and just dump them in the bins. That's my first recommendation. And if you don't have access or you don't have transportation, you can take anything that's unpalatable, coffee grinds, cat litter, dirt, and mix these pills with them, put it in a Ziploc bag and throw it in the trash. That would be my recommendation.
And if I caught what you were saying earlier correctly, it seems that for those expired medications, there's generally not a danger in using them. It's just more that there may be some degradation in the quality of the medication, so they perhaps aren't as effective as they would be if they were not expired.
Right, exactly. It's like it's lost its potency basically, and it would not work as good as it was before.
I've seen an interesting change over the last several years, certainly as a physician, in terms of how I prescribe. When I first got out into the real world of medicine, I walked around with a prescription pad in my hand. And when it was time to write a prescription, we literally wrote a prescription. We got out our pen, we got out our pad, and we had to write it out. And then it would come to you and to your colleagues, and you guys would have to decipher my horrible handwriting and all of that. And then a few years ago, we started doing more and more prescriptions electronically through some of the electronic medical record systems. And now here we are, and we don't even have, in my practice, access to a prescription pad. We have to do it all electronically. So I'm curious about, sort of the evolution of moving to this electronic prescribing, what you've seen at the pharmacy level. If you have any comments about whether you think it's a good thing or a bad thing, and stuff about, sort of this move to the electronic approach.
Right. Basically, I am a big fan of e-prescribing. Like you said, I don't have to decipher your handwriting or any doctor's handwriting, physician's handwriting, because, we all know it's not the neatest. But it's just so convenient. My theory is you can have a telemedicine appointment with your physician, and it could be in like Nebraska. Say you found the specialist in a different state, and but you live in Virginia. That doctor from Nebraska can send a prescription right to your local pharmacy, and you can pick it up. You just have to go in there once. You're not making multiple trips to drop off the prescription, then wait, then go pick it up. So it's just like a one stop. And also there's less chances of error. All the fields need to be filled out before you can fill and prescribe and e-prescribe. So I feel like there's no time where I need to call the physician. The patient has to wait. They can't get their medicine the same day because the physician's not answering their phone. It's a lot of back and forth.
One of the nice things at Let's Get Checked is that we're able to e-prescribe against some of our STD tests and things like that. And quick access to those patients in terms of their ability to get a medication sooner rather than later is a true benefit to them. Any general comments around people as they interact with their pharmacy in terms of how should they be thinking about storing medications, thinking about, looking at other medications that they're on, interactions? I mean, are there sort of some general comments you could make to try to keep us all safer and healthier?
Oh, of course, yes. I would say, most people, when they go to the pharmacy, they come out and they see this long, explanation of, their medications. And you don't have, I suggest you read it, but it's a lot of work. So I think that while you're at the pharmacy, you should bring a list of your medications with you. We're there to help you and tell you if there are any interactions. Have the pharmacist explain to you what the medicine is for, why you're taking it. I see some patients, they just come and they say they have no questions, which I understand. Maybe later they will and they can call us, but I feel like you should ask your pharmacist to take that time out to actually go over and explain your meds to you. And also, if you have questions, we're available. Just take advantage of that availability of us is what I recommend. I just want, people to know that we are healthcare professionals on the front line. So if there's any time that a doctor or physician or any health professional is not available, we are always here. So I just want everyone to know that.
Great. Well, Dr. Sood, thank you so much for your time today, and look forward to continuing to work together a lot in the future. We'll get you back on one of these at some point down the road also, hopefully after COVID.
Yes, thanks for having me. Thank you.
Of course.